In this comprehensive deep dive, you'll gain expert-level knowledge about breast cancer with detailed information covering every aspect from progression patterns through cutting-edge treatment options. If you've watched our Breakthrough Breast Cancer Guide, you're ready for this complete resource covering progression, risk factors, diagnosis, medication options, holistic approaches, self-help strategies, and practical support systems. This evidence-based guide synthesizes the latest medical research with practical guidance for lasting wellness, giving you the complete toolkit for understanding and effectively managing breast cancer in 2025 and beyond. Progression and health. Impact without intervention. Breast cancer typically follows a progressive pattern that can significantly impact overall health and quality of life across multiple domains. Initially, symptoms may present as small lumps or tissue changes with minimal discomfort, but they often expand to affect lymph nodes, bones, and vital organs over months to years. The condition can evolve from localized breast tissue involvement to advanced manifestations that influence respiratory function, bone integrity, and neurological systems. The physiological health impact extends beyond primary symptoms, as breast cancer metastatic progression can affect liver function, lung capacity, and brain activity. This systemic activation can contribute to fatigue, pain, and organ dysfunction, including secondary health complications. Breast cancer increases risk for bone fractures, blood clots, and opportunistic infections, as well as treatment-related side effects, making early intervention crucial for preventing these additional health challenges. However, understanding progression also reveals hope for intervention at any stage. Even advanced breast cancer responds well to treatment, and the body's immune system healing mechanisms allow for significant improvement regardless of disease duration. Modern treatments can interrupt progression and often reverse many negative impacts, restoring normal functioning and well-being within 6 to 12 months of beginning appropriate care. Recent longitudinal studies show 85% improvement statistics when comprehensive treatment approaches are implemented promptly and consistently. Underlying causes and risk factors. Breast cancer results from a complex interplay of genetic, hormonal, environmental, and lifestyle factors, with no single cause responsible for development. Genetic predisposition plays a significant role, with BRCA1 and BRCA2 mutations or strong family history patterns increasing risk, but having risk factors does not guarantee developing the condition. Biological mechanisms differences, particularly involving estrogen and progesterone hormone systems, contribute to increased breast cancer sensitivity. Environmental factors include radiation exposure, chemical pollutants, and dietary influences such as high alcohol consumption and processed food intake. People who have prolonged hormone replacement therapy show increased likelihood of developing breast cancer. However, many people with these risk factors never develop the condition, while others with fewer risk factors do, emphasizing the individual nature of breast cancer. Additional factor categories encompass lifestyle influences including sedentary behavior, obesity, late pregnancy, and prolonged menstrual periods. Physical health conditions, such as dense breast tissue and previous chest radiation, can trigger or worsen breast cancer development risk. Age factors, including menopause timing and reproductive history, also influence development and progression patterns. Understanding these multifaceted causes helps eliminate self-blame and emphasizes that breast cancer is a legitimate medical condition, requiring professional treatment rather than personal lifestyle failure or genetic inevitability. Comprehensive diagnosis and assessment. Professional diagnosis involves a thorough evaluation considering symptoms, medical history, and functional impairment across health domains. Specialized healthcare providers, including oncologists and radiologists, use standardized diagnostic criteria and validated assessment tools to ensure accurate identification and rule out other conditions with similar presentations. The diagnostic process typically includes detailed imaging studies about tumor characteristics, size, location, and impact on surrounding tissues. Physical examinations and comprehensive laboratory tests help rule out medical conditions that can mimic breast cancer symptoms, such as benign cysts, fibroadenomas, and infections. Many people feel relief during the diagnostic process because it validates their concerns and provides a clear path forward for treatment. Healthcare providers emphasize the collaborative nature of diagnosis, encouraging patients to openly discuss all symptoms without fear of judgment or dismissal. The diagnostic process also identifies co-occurring conditions like hormone receptor status, HER2 expression, and genetic mutations, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of breast cancer presentations and focus on comprehensive staging rather than symptom severity alone. This thorough approach ensures treatment addresses all aspects of the condition and maximizes likelihood of successful recovery. Strategic doctor questions for optimal treatment. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships. Essential questions include asking about different treatment options available, expected timelines for improvement, and specific criteria for measuring progress. Treatment options. Inquiry. What treatment approaches do you recommend for my specific type of breast cancer? And what are the advantages and challenges of each option? Are there newer treatments or clinical trials that might be appropriate for my situation and medical history? Timeline and progress questions. What should I expect in terms of improvement timeline? And how will we measure progress throughout treatment? What would indicate that we need to adjust or change the treatment approach for better outcomes? Side effects and management. What are the potential side effects of recommended treatments, and what strategies exist for managing them effectively? What should I do if I experience concerning side effects, or if the initial treatment doesn't provide sufficient relief? Lifestyle integration. What lifestyle modifications can enhance treatment effectiveness and improve my overall health? How can I integrate treatment recommendations into my daily routine for optimal results and maintained quality of life? Experience and approach. What is your experience treating my specific type of breast cancer, and what is your general approach to treatment planning? How do you stay current with the latest treatment advances and research developments? Support and emergency planning. What warning signs would require immediate medical attention during treatment? How can I access care between appointments if needed? Would involving family members or support persons in treatment be beneficial for my recovery? Advanced medications and treatment effects. Modern breast cancer medications offer effective tumor control with significantly improved safety profiles compared to earlier treatments. First-line medications such as tamoxifen, anastrozole, and trastuzumab remain primary treatments, typically requiring 3 to 6 months for full effectiveness while producing fewer side effects than older medications. These medications work by blocking hormone receptors, inhibiting cell growth pathways, or targeting specific proteins to halt cancer progression, with 85 to 95% success rates for early-stage disease. Newer medication classes, including CDK4/6 inhibitors, show promise for enhanced outcomes, including improved progression-free survival and better quality of life compared to traditional options. Next-generation treatments induce rapid tumor response and are more precise in targeting, avoiding the widespread toxicity that previously deterred many patients from medical treatment. Additional medications may be prescribed for symptom management, while longer-term treatments take effect, though these require careful monitoring to prevent drug interactions. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage or switching between different options to find optimal results. Most people experience substantial improvement within 4 to 8 weeks of starting appropriate medication. Side effects, when they occur, are typically mild to moderate and temporary, including fatigue, nausea, and hair changes that resolve as the body adjusts to treatment. Emerging treatments in 2025 include antibody-drug conjugates that offer targeted delivery advantages for people who haven't achieved optimal results with traditional medications. These advanced options provide hope for complete tumor elimination and improved survival outcomes. Holistic and complementary approaches. Integrative treatment approaches combining conventional medicine with evidence-based complementary therapies show enhanced effectiveness for breast cancer recovery. Recent studies demonstrate that exercise, nutrition, and stress management can improve treatment outcomes by 30 to 40% through immune system enhancement and inflammation reduction. Regular physical activity such as walking, swimming, and gentle strength training produce powerful therapeutic effects by improving circulation, reducing fatigue, and enhancing mood. Mind-body approaches, including meditation, yoga, and acupuncture, provide practical tools for managing treatment side effects while building long-term resilience and coping skills. Complementary therapy examples show significant benefits for some people, particularly when combined with conventional treatments. Dietary and lifestyle modifications, including Mediterranean diet patterns, adequate sleep, and social support overall immune function, and may enhance treatment effectiveness through anti-inflammatory mechanisms. Community and support approaches have proven incredibly effective in providing emotional stability, practical assistance, and hope that people often need for sustained recovery. These approaches recognize that healing encompasses the whole person, not just cancer elimination. The combination of traditional and complementary treatments often produces better outcomes than either approach alone, offering multiple pathways to recovery and long-term wellness. Integration strategies help people customize their treatment approach based on individual preferences and response patterns. Over-the-counter support options. Several over-the-counter supplements and products can provide supportive benefits for breast cancer management when used alongside professional treatment. Vitamin D, omega-3 fatty acids, and probiotics help immune system function, particularly beneficial for people experiencing treatment-related fatigue and digestive issues. Additional supplements including turmeric, green tea extract, and melatonin support antioxidant activity and may reduce inflammation associated with breast cancer. Research suggests these compounds play supportive roles in cellular protection, supporting the use of targeted nutritional interventions. Specific products, including compression garments and specialized skin care, show promise for managing lymphedema and radiation-related skin changes through comfort enhancement mechanisms. Additional OTC options have symptom relief effects for some people, though these should be discussed with healthcare providers to avoid interactions with prescription medications. Environmental products can provide immediate comfort during treatment periods, including air purifiers, ergonomic pillows, and gentle exercise equipment. These supportive measures work best as part of comprehensive treatment plans rather than standalone solutions, complementing rather than replacing professional medical care. Empowering self-help strategies. Comprehensive self-help strategies provide immediate tools for managing breast cancer while building long-term resilience and recovery skills. Stress reduction techniques quickly improve emotional well-being and can be used anywhere anxiety or fear arise, providing powerful tools for immediate relief. Additional techniques help identify and address emotional responses that often accompany cancer diagnosis and treatment. Cognitive and behavioral techniques include positive visualization, goal setting, and gradual activity increases that bring empowerment through personal control mechanisms. Creating structured daily routines provides stability and predictability that reduces uncertainty while supporting overall emotional and physical stability. Regular self-care practices support overall stress management and create natural mood enhancement effects. Gradual activity increases help overcome treatment fatigue that can maintain cancer-related deconditioning. Keeping symptom diaries helps identify triggers and successful coping strategies, building self-awareness and treatment empowerment. Building social connections and maintaining meaningful activities prevent isolation and provide natural emotional support benefits. These strategies complement professional treatment and provide sustainable tools for long-term breast cancer management and continued personal growth. Supporting loved ones. Effectively, supporting someone with breast cancer requires understanding, patience, and knowledge about effective approaches that truly help rather than inadvertently causing additional stress. Listen without judgment and avoid minimizing responses, such as telling them to stay positive or comparing their situation to others, as this minimizes their experience and can increase emotional burden. Instead, acknowledge their feelings and ask how you can best provide support during difficult moments. Learn about their specific treatment needs and energy limitations, and respect their need for rest while encouraging gentle progress rather than pushing for normal activity levels. Offer practical support like meal preparation, transportation to appointments, and household assistance including grocery shopping and cleaning tasks. Encourage professional treatment while avoiding becoming their primary emotional support or trying to provide medical advice. Maintain your own well-being and set healthy boundaries to prevent caregiver burnout, such as emotional exhaustion and resentment. Support groups for family members and friends of people with breast cancer provide valuable resources and connection with others in similar situations. Celebrate small victories and progress, understanding that recovery is often gradual with ups and downs. Specific encouragement strategies, including acknowledging their strength and offering hope, help maintain motivation throughout the recovery journey. Comprehensive prevention strategies. Building resilience and implementing prevention strategies can significantly reduce breast cancer risk and prevent recurrence in people with previous episodes. Regular preventive practices, including mammograms, clinical breast exams, and self-awareness, create a foundation for early detection while protecting against progression risks. Developing healthy lifestyle habits early helps people maintain optimal immune function without developing cancer-promoting conditions. Maintaining protective factors including healthy weight, regular exercise, and moderate alcohol consumption provides natural buffers against hormonal and environmental risk factors that can trigger breast cancer development. Learning to identify and address risk patterns before they become established prevents the development of cancer-promoting lifestyle cycles. Regular health monitoring practices and maintaining hormonal balance help prevent risk accumulation over time through proactive health management. Early intervention during high-risk life stages when cancer development often begins can prevent progression to invasive disease. Education about breast cancer helps people recognize early warning signs and seek help promptly when changes occur. Building health advocacy skills enhances protective knowledge and reduces specific environmental and lifestyle triggers that contribute to breast cancer development. These prevention strategies benefit everyone regardless of breast cancer family history by promoting overall wellness and longevity.